Good afternoon. My name is Caitlin Christensen, and I am part of HSC 4713, Section 1324, during the spring semester of 2016. Today we're going to be discussing Chapter 8 from our textbook, which is all about interventions. Let's go ahead and dive right into the material by starting off with the learning objectives. After going through this lecture, you will be able to 1. Know what an intervention is. 2. Explain the difference between dose and multiplicity. 3. Understand the different types of strategies for interventions. 4. Know the steps needed to design an intervention. 5. Be able to come up with an appropriate health promotion intervention on your own during an activity. Okay, now let's move on to the actual material so that you can better understand what these learning objectives have to offer you. What is an intervention? An intervention is a strategy that will include either an activity or a multitude of activities pertaining to a certain health issue that a population in need will take part in. Interventions are looked at as treatments for these priority populations that need health promotion on a certain health issue. Each intervention has its own multiplicity, and this just means the number of activities in an intervention. For example, you could give monthly meetings on a health topic as well as give out pamphlets and even give out screenings. All three of these activities would be part of a multiplicity of the intervention. It has been proven that the more activities you do in an intervention, the more behavior change in the long run. Interventions can be broken up into more fine details other than just the amount of activities, the dose of each activity. This just means questions like, how many pamphlets are you going to hand out? And how many times a month are you going to have the committee meet? Like stated in the previous slide, each intervention can have their own multiplicity, but there are really only two types that you can have: a single strategy and a multi-strategy intervention. We're going to discuss the pros and cons of both types. The pros for a single strategy are that it's less costly because only having to do one activity rather than 3 would lower costs, and that is much more easier to create. And it's much more easier to create just one strategy for a population that can be so similar and not diverse enough to handle more than one strategy. The pros for a multi-strategy are that it will work on a larger diverse population because there will be a strategy that works for everyone and in turn will leave lasting change. And with having multiple strategies, you can work with multiple settings because you can customize your strategies to the different types of setting in the same intervention. The major con for using a single strategy intervention is that it will simply not work for every type of person that shows up in a population. The only minor con for using a multi-strategy intervention is that eventually it can become very costly because the more and more activities you end up using during your intervention, somewhere along the line, money will pile up. First, we're going to discuss the health communication strategy. This strategy uses different types of communication to get the idea across and influence a population's decisions regarding health. This is done through using different types of communication, like acts of listening and speaking, while also being done through different types of media, like social media, radio, television, and even the newspaper. Health communication strategy has the highest penetration rate, meaning that the ideas of the strategy reach high numbers of people in the population. An important thing for planners to take into account is the literacy rates of those in the targeted population, because not only will this affect the written forms of communication, but words that will be spoken in listening forums may not be recognizable. Here, we have an example of some literacy rates from around the country, and it shows just how important it is to take into account how low some of the rates are in certain states. The next strategy we're going to talk about is the health education strategy. This strategy is much like the health communication strategy in the way that it uses communication to get the ideas across, but uses things like brochures, whereas this strategy uses the planned learning experiences to provide knowledge and skills to the learners in more formal educational settings. This strategy uses something to plan ahead for the activity, like a meeting with a certain group in the community, to teach them about the topic at hand. A lesson plan is used to plan ahead. The lesson plan is broken down into the curriculum, which would be what the lesson is about. Then, the curriculum is broken down into a sequence that will give the planner a schedule of when what will be taught. Then the sequence can be broken down into units of study. So what exactly will be taught during a certain time frame. Finally, the units of study will be broken down into lessons that are every so often. Here I have an example of a lesson plan format, and as you can see, it's broken down into many different parts. There's a section for resources, lesson topic, key learning area, the outcomes, how long it's supposed to last, and so forth. The next strategy we have is the health policy and enforcement strategy. The health policy and enforcement strategy includes things like policies, regulations, laws, rules, and position statements. This type of strategy regulates the behavior of a population by almost forcing them to change, by putting in laws to make sure people wear things like their seatbelt. Like the picture I have of Click It or Ticket, these strategies use incentives and disincentives to get people to change their behavior. For instance, in this picture, there's an $86 fine if you're pulled over and not wearing your seatbelt. An example of an incentive for the health policy and enforcement strategy would be things like organizations that can give donations as a write-off on their taxes. This website I've hyperlinked to the slide takes us to a website that breaks down every state's ticket prices for not wearing a seatbelt. This is a good example of how some states or counties make the ticket prices much more higher as a strategy to get more people to wear the seatbelt. And this is a great example of how you have to change a certain strategy for the type of population and community you have. On the website, we see that 34 states have primary laws, 15 states have secondary laws, and states like North Carolina have a $25.50 ticket law for not wearing a seatbelt, plus $135 in court costs just for not wearing your seatbelt. That doesn't change your behavior. I don't know what will. The next strategy is the environmental change strategy. This strategy helps remove barriers in the environment. Many people and communities and different types of populations say that there are barriers as to why they can't change a behavior. And this strategy focuses right on removing these barriers. Now, just because it's an environmental change does not mean that it's just the outside. And it's not just the population surroundings, but it can be service, cultural, economic, social, psychological, and even political environment. For an example, a social environment change strategy is the Smoke-Free Workplace campaign. Here I have a picture of an example of what would be placed in a workplace to let everyone know that they have signed the petition for a smoke-free workplace. And if you can see, the bottom of the poster has the name and signature of the owner of the company. I have also attached a hyperlinked website, and it takes us to an example of how to fill out a petition to become a smoke-free workplace. Fortunately, many of the places in America today are smoke-free due to the knowledge we have on what secondhand smoking can do to our bodies. Here we have the health-related community service strategy. The health-related community service strategy includes services, tests, treatments, and even care at low cost for populations that have lower socioeconomic statuses. Therefore, a lot of examples are flu shots and immunizations at a low cost for children and adults, health screenings for things like diabetes, blood pressure, and even things like breast cancer for those who cannot take care of their own health issues and do not have the financial stability to pay for these screenings. A lot of these are often offered at places like grocery stores, malls, workplaces, health fairs, and really anywhere that can hold a lot of people. Here I have hyperlinked the grocery store Publix's website, where they offer flu shots at a low or no cost at all. The hyperlink directs you to the Publix website, where you type in your information regarding the area you are in, and it'll help you find a low-cost flu shot. This is especially necessary strategy for many populations that are of lower socioeconomical status. This can help a lot of people that have the health education on many health issues, but just don't have the fundings to actually take care of the health issue related to their community. The next strategy we have is the community mobilization strategy. The community mobilization strategy gets the community to identify the problem and take its own action. This can be done in one of two ways, either by community organization and community building, or community advocacy. Community organization is basically getting a group from the community that is willing to take action and come together to be in charge of the behavior change of their population. And community building is getting the community to work together to change behavior and work on the community assets. Community advocacy is when the community actually gets involved in the decisions that will have an impact on their lives, not on just their health, but many other policies and laws. One big way a community can become advocates is by writing to their local newspapers, getting the word out about certain things so that the rest of the population can learn about what needs to change for their community to change. Community members can also exercise their right to vote to change policies in their population, and this in turn has the community working together to take action on what needs to happen in their certain population. Before you can come up with an intervention, there are a few questions that need to be asked to design an appropriate intervention. An intervention is not just when you come up with certain activities to change a behavior of a certain population. But it has to be one that fits that certain population so that it actually does more good than bad. Some of the questions that need to be asked before you can actually come up with your intervention. 1. What needs to change? 2. What level of prevention will the intervention be aimed at? Primary? Secondary? 3. What level of influence will be focused on? 4. What type of strategy will be used? 5. Will the intervention fit the intended population? Basically, this question is asking, is this intervention going to work for a population that might not have high literacy rates? 6. Do you have the resources available that are necessary? Do you need to do fundraising? Do you need to find the funds so that you can hand out pamphlets to everyone in the community or get people to come out for screenings? And finally, 7. Are you using a single strategy or a multi-strategy for this population? And at this point, if you have answered single strategy, you should probably go back and see if there's another strategy that'll work for your population. Because as we mentioned earlier, the more strategies you use, the more ground you can cover with a diverse population. These questions are the building blocks of coming up with an intervention. As long as you follow this sequence, you will have a great intervention. And finally, we've come to the activity that everyone is going to be involved in. You will all be given a different type of scenario for a certain population in a community. You'll need to come up with an intervention using steps given on the previous slide, and make sure you go through steps 1 through 7. You must use one of the strategies we've discussed today in our lecture and explain why you have chosen to use this strategy for your intervention. And if you decide you need to use multi-strategies, then you need to explain why you used each one and why you feel these are the best ones to use. Now, if you end up using a single strategy, explain why. Explain why that benefits your type of population and why you didn't use a multi-strategy. Give examples on how you would implement this intervention to your community. Do you have the funds to implement? And if you don't have the funds to implement, then what would you do to get the funds? And finally, predict how your community would do with the intervention and give a good explanation. Here I have the references from all the pictures and hyperlinked web addresses I've used throughout my PowerPoint. I hope you've learned quite a bit from the Chapter 8 interventions of our textbook.